Hey, welcome to the channel. You're most likely a medical student or want to become one. And do you wish that sometimes you had a mentor that could follow you around and answer any question you had, at least in regards to medical knowledge? Well, I have compiled a list of some common apps or popular apps that I've been using over the last 3 years of medical school that can pretty much do that. So let's get into it. So let's dive down into my phone here. Pull out your phone so that you can download some of these apps and take a look, all right? So the first app, highly recommend, please download it, is QuickEM. This is by far one of the most helpful apps, especially when it comes to emergency medicine. We're coming up with the differential. So I'm gonna open it up here. I do think there's a paid version, but this is completely free. What I'm showing you, you have adult and pediatric complaints. Clicking on the adults, you go through here, altered mental status, headache, head injury, syncope, the most common conditions that you'll come across. So I would often come across a lot of syncope working at the Civic Hospital in Ottawa. So sometimes I would click here and come up with a differential. So it could be cardiac, vascular, metabolic, neuro, and pulmonary. So these are the differentials within those categories. Okay, some of the ones that I would be thinking about. Let's see if I can come across like a pulmonary embolism. Let me move down here. Orthostatic hypotension, and rule that out. Hypoglycemia, rule that out. All that. Anemia, rule out a stroke or hemorrhage there, rule out seizures. Vasovagal, sure. Pneumothorax if you think so, and so on. So once you have your differential, you know what kind of questions to ask, or do you? Because if you don't, then we can move down to history and it will tell you exactly what you should be looking for. Your HPI, generalized eye movement, could be a seizure. You know, if it was a witness syncope, how long, what happened afterwards or until you return to baseline. Talk about or ask about past medical history, about their meds, social history, do they do drugs, alcohol, what's their living situation, highly important for those elderly patients, like do they live at a home, like a nursing home, do they live at home with their husband or wife or with family, or are they home alone? And then what symptoms have they been experiencing, kind of review some symptoms, so chest pain, shortness of breath, abdominal pain, and so on, okay? So after you do the history, you can write this down on a piece of paper, and so that you go in somewhat prepared. It's in your mind, it's on a piece of paper. And actually sometimes if I really forgot and I had no clue, I exhausted all my questions, I'd pull out the app, I'd pull out my phone and be like, hold on, just give me a second, I just want to make sure I don't miss any of the important questions, make sure I don't miss anything. I'm just going to be looking at this app, or I don't even tell them it's an app. They just assume I have questions. Just so I'm not pulling out my phone in front of the patient, I think it's disrespectful. I tell them that it's to help them, and I've seen doctors do this, so that's why I do it. So physical exam, you know, what are you looking for? Appearance, your head and neck, your cardiovascular exam, your rest, abdo, back, extremity, skin, and so on. Beautiful app. Honestly, this is really all you need when you're doing emerge. Come up with that differential and what to say. And then you can consider the tests that you're going to order next, and then how to treat and disposition and so on. Okay, so highly recommend this. It's got all these features, so from neuro, HENT, thorax, abdomen, extremities, vital sign abnormalities, and miscellaneous. And then it also has for pediatrics. So if you're doing pediatric rotation or you're doing family medicine, you have some peds there, some kids, then you can cover that. Now, they also have what I see is medications in recess, but you have to unlock the premium features. The next app we're going to go to is the AMBOSS app. If you've watched my previous video, I've covered in depth some resources that I use, and AMBOSS was one of them. I mentioned that they have an app, so let's take a look there. AMBOSS app opening. At your fingertips, you have all the medical knowledge that you're really going to use. You type in whatever you want here. So let's scroll up and just click something. So affective disorder, studying that for my OSCEs. Click it and you have the etiology, the clinical features, how to diagnose it, how to treat it. Okay, so what to look for, you're looking for hallucinations, delusions. You know, how are you going to diagnose it? You want to look at these factors. Okay, laboratory studies as well, and then treatments. Let's look at something else. Let's look up something everybody kind of knows a little bit about, MI. myocardial infarction, click that, and there's so much here. So what's the pathophysiology of it? What are the clinical features? So retrosternal chest pain, brought on with exertion, relieve with rest, relieve with nitroglycerin. Some of the clinical features, we just click that. Diagnostics, how are you gonna diagnose this? You wanna order ECG, you wanna order troponin and some of the other biomarkers here, troponin, CKMB, and then myoglobin. Has some graphs and videos if you need it. Once you have the diagnostics, then you're thinking differential diagnosis. You could be thinking of that before you see the patient. And then treatment, what should I do? Okay, so this is a great app to look at. Here's the outline as well, if you wanna jump straight to a section. Exit out of that, come back. They also have this drug database, so you can click right here, search it up. If you want to click metoprolol, click that, and you want to study a little bit of the medication, introduction, usage, dosage, cautions, pharmacokinetics, actions, advice to patients. This is all things that you typically learn over time, but with some more intention, this app will help you brush up on those skills. And here's a library. Again, if you want to do ANKI sessions, come to clinical skills, go through the cases and their survival guides, transition residency, Clerkship there, basic sciences, and on-call survival guide. I wish I had read that before I went on call, but I was not aware of it. And then here's some more lists and the settings here. So again, you got to pay for this to have access to this. And the really cool thing is that with the AMBOSS, you can have it on the computer, you can have it on your phone, and you link it up with your ANKI flashcard decks, and it will underline topics so you can look up on AMBOSS at that exact moment as you're studying. Before I move on to the next app, I just want to introduce myself. If you're new here, my name is Thiago Luzvardi. I'm a 4th year medical student. If you like the content so far, please subscribe, hit that notification bell, hit the like button, and drop a comment down below. Let me know what you like and what you want to see in the future so I can help you out even more. The next app that we're going to be looking at is the MDCalc. Very useful for equations that you don't want to memorize but you need to use. So a typical one is right here is the creatinine one, but let's hit the Canadian CT head rule. Very testable and pimpable. You'll get pimped asked during your emerge rotation, especially here in Ottawa. And you can see that it has the instructions when to apply it. They have to at least have one of these. Here are the exclusion criteria and then what to use. So you look at your patient after, are they above 16 years of age? Yes. Are they on blood thinners? Probably. Seizure after injury? No. Okay, so it says they're not eligible. Okay, so you can change it up until they become illegible. I'm not going to keep doing that. And then it gives you recommendations. So here are the next steps: advice, management, critical actions, and then evidence supporting it. Okay, so the inclusion criteria is loss of consciousness, witness disorientation. So if I hit 16 age is less than 16, they're going to be older. If they're on blood thinners, let's say no, because that'd be an exclusion. And seizure, hit no. You go to GCS, yes, whatever. Boom. And see already a change at the bottom here to consider for a CT head. Other equations you can look up, it can be anyone. So creatinine clearance, here you go, all the variables, you just pull it out, calculate it, and you'll have your answer. Pretty simple, pretty straightforward, all these equations that can be useful. Moving on to the 4th app that you can use is the Ottawa rules. Very important for the Ottawa students. You can use it, you don't have to use it, but you know, we have all these rules here. It has the knee, C-spine, ankle, CT head, SA, subarachnoid hemorrhage, and the transient ischemic attack rules. Okay, so typical one is like Ottawa ankle rules. Do they have bony tenderness in these locations? Let's say yes, yes, and yes. Boom. Diagnostic imaging is required. Again, there's a C-spine one. Rule not applicable if they have any of these. And then do they have this? Yes. Okay. Diagnostic imaging is required. So very quickly you can pull this out after you see a patient and you know what to tell the preceptor that you want to order or the attending that you're working with. Okay. Moving on to the 5th app is Uworld. So I don't use this one too much. I'm gonna open it up because I'd rather do questions on my laptop, but you can see that you can select your questions here and then start. So if I do family medicine questions in dermatology, you select that and then start your question. Moving on to the 6th app, it is by GeekyMedics. Covered that in a previous video as well in regards to the computer version. But if you download it, you have the clinical examinations here, at least for cardiovascular. If you want to unlock the rest, then you have to pay for it. But if you want to learn how to do a cardiovascular exam, here's a video, and then they walk you step by step about inspection, palpation, auscultation, everything you need to look for. You have the clinical procedures, data interpretation. Again, these things are free online, but on the app you do have to pay for it. Probably does cost more money to actually run an app than surgery and so on. So this is helpful if you want to put in the money, invest the money to have all this information at your fingertips. These are apps that you can use if you want. You don't need them. I highly recommend the QuickEM app. If you have AMBOSS, highly recommend that. It's so easy to search things up. Everything else, to be honest, I don't really use out of these ones. I sometimes use the MDCalc when I got asked questions about it, and then everything else will depend on what your university uses. But I highly recommend downloading these apps because it will make your life a lot more easier, especially when you have a question, you just want to look something up. It's right at your fingertips. Okay, so if you enjoy the content, make sure to like, subscribe, drop a comment, share this video with your friends, and don't leave yet, watch this video.